you just brought up fluoride, and I've been told my whole life that the more fluoride is in the water, the better. And now you're saying it's not good for, like, explain that. Why is fluoride not healthy for people? And where's this lawsuit coming from?
Yeah, yeah. So, classically, and I want to say this too. I said a lot of these things too. Like I
Hmm.
started off this way as well, and I think what God gave me a pretty open mind, and I think
Hmm.
that's allowed me to start to learn these other things, and to speak to other human beings and learn from mentors of mine, and not be so myopic or closed-minded that we think we know it
Yeah.
all. And I will classically always say, the more that I study and learn, the more I realize we don't know squat. God made us. I think teeth are
Yeah.
perfect example of a creator. And
Mm.
I tell my patients that a lot. I mean, the way that they're designed, and we can kind of dive into that like honey hole, but like it's a perfect example of a creator. And so I just think God has woven himself throughout my patient interactions and what we're doing on a daily basis. And people come into us sometimes as a last resort, and they have all kinds of other health issues, and we start to locate things in their mouth that can be driving some of those issues, like autoimmune diseases, like chronic inflammation, like uh, insulin resistance and type 2
Mm.
diabetes. Like their mouth plays huge roles in those things. And if we're not helping our patients from that standpoint, we're not helping them, you
Yeah.
know? Yeah. Yeah. So fluoride is a great one. I mean, for any of the listeners out there, this is a really
Hmm.
pointed topic. Where I was going is that, I told a lot of people that it's a tooth vitamin. Like that's how we verbiage it, but like that's not true at all. It's not a vitamin at all. And
Mm.
so one of the best resources on this specific topic is a website called Fluoride Action Network. They're phenomenal, and they'll show tons of studies for the people that want to get into my engineering patients want to see. I want to see the studies. I want to see the stuff,
Oh
and
yeah, they do.
I throw it
They
all
do.
at them. I love those patients. But that's a great one to prime a lot of the public, because what we've known for a long time, there's plenty of literature to show it definitely lowers IQ in children. So that's the big one, and
Wow.
that's kind of the main focus of the lawsuit. So neurological issues with it. It's also really hard on the thyroid. It's hard on your bones as well. Your
Ooh.
pineal gland, your all-seeing eye, that intuition
Hmm.
that gets calcified with fluoride. So there's a lot of things that it affects. And if you brush your teeth with fluoride toothpaste once, are you gonna die? No. But every single day, 2 or 3 times a day, and then getting it
Hmm.
from your water and all the other sources that we're getting, you're getting a long-term chronic exposure that's becoming a problem. Yeah. Yes, and fluoride
Wow.
in your water, particularly on that
Yeah.
website, they actually show that a lot of other countries don't fluoridate their water. And over the
Mm.
last so many decades, they've actually seen the drop in cavities that we've seen. So it's not from fluoride in the
Really?
water. It's from that
Okay.
we've gotten better at understanding some of these things and improving our hygiene habits and things like that. But it's definitely not from fluoride in the water.
So how did it originally start getting? How did we originally start putting fluoride in our water? Was it like how did that originally even? What was the impetus for that idea? Was it the fact that hey, this will make your teeth stronger, so to speak? I mean, it's just kind of like the verbiage I've heard. But why did they start doing that? Is that the
Yeah.
reason?
Yeah. Yep. It started with a group I think a gentleman in Colorado, if I remember right, and he was noticing that they had higher fluoride in the water, and he was noticing some of the changes with teeth. And if you get too much fluoride, you'll see what's called fluorosis, which is white spots on people's teeth, and they become kind of brittle. Um, when you dive into the rabbit hole of this stuff, just like I know you dove in on a lot of things too, coming from your career and then diving into health and maybe things that you
Yeah.
always thought, weren't always true. And I think some of these things have always been there. We're just waking up to them more so now. But one of the things with the fluoride topic, that the rabbit hole that I dove into and found out, was it's what we put in the water is typically a couple of forms of fluoride. The big fancy long terms, but basically a lot of it is a runoff from fertilizer companies, from phosphate fertilizer companies, and
Oof.
it's absolutely illegal to dump in the ocean. So we needed a disposal mechanism. Yeah, it's wild. Like
No
it's wild.
way.
Yeah, just like the Flexner report, like you've heard of that topic. Like we used to not really be
Yeah.
so pharmaceutically driven, and then all of a sudden we were, and we're our ages. We don't know what happened in the 10s and 20s, but like this thing's
Yeah.
actually happened, and we just kind of forget or we don't know. Yeah, pretty
Wow.
wild.
It's pretty crazy. Yeah, when you start going down the rabbit hole on a lot of the things that, we've mostly just assumed, hey, this is common knowledge. Like and you've heard it. I've heard it said like much of common knowledge is a reflection of social bias. Like over the course of time, we all start to kind of just collectively believe something because it was once believed. But I don't know what it is, if it's the internet or what, but we're sort of like kind of peeling back the onion and realizing, hey, there's a lot of things we've been doing for a long time that maybe aren't the best way to go about things. And I don't know if that's just human nature in general. Maybe it's just like the trial and error of being alive as a human being. But I think, I mean, whatever it is, the prevalence of information, the open airways of information on the internet has like allowed for people like you, like people that are experts and have practiced these things and go, hey, like, I know you've been doing this, but maybe we need to go in another direction. And fluoride's one of those topics because it's like you go to the dentist and go, hey, here's a fluoride toothpaste, here's a mouthwash that's has fluoride in it, and make sure you use it all the time. And that's just kind of what you're told because you'll have stronger teeth. And it's kind of like the doctor tells you drink, tons of milk so you can have strong bones from the calcium. And there's no other factors at play whatsoever when they
Yeah,
tell you that, and you kind of going, oh man, this is actually affecting me in a number of other ways I wasn't expecting.
totally. And I think that's where it's very humbling to realize that simple, quick fixes aren't typically the best ways. And that's hard. And that's hard for me in my life. The simple, quick fix sometimes is to give, one of my 4 kids exactly what they want when they want it.
Yeah,
And
for
usually that's
sure.
not the best way. I've made that mistake multiple times. And so I think in that situation, when people have, cavities, for example, and dentists are trying to do the best they can. Like we all are. I really do believe in the goodness of people. But I think dentistry is one of those branches of healthcare that we've a lot of old dogs, old tricks. We've been doing these things for a long time, and although we've had advancements in some sectors of dentistry, there's other areas of dentistry that we haven't had as many advances in. And I think that's where my passion lies into like, how can we advance this thing? Because it needs it. Like if you're getting cavities, it's not a lack of fluoride. So what's the microbiome look like? What's your gut look like? And again, it's humbling to realize there's so many factors in this, and it's our job to be a detective and try to solve that for patients. And it's not always easy either, for sure.